The following video presents some common post-surgical guidelines for someone with your condition, but the doctors and medical staff will provide you with specific directions for your personal situation. When it comes to recovery, you play a big role in your healing. By following your specific medical instructions, you will better ensure a good recovery. On the other hand, not following the medical directions given to you may impair your recuperation. We're committed to your successful recovery and want to assure you that we are here and available even after you go home. To make sure everything is going well, someone from the Surgery Center will call you within 24 hours to learn how you're doing. If you're having any problems or need information or assistance, don't hesitate to call our doctor's office. Either your doctor or one of the physician partners is always available. You will most likely be prescribed an antibiotic drug. These medications are very important to take on time until they run out as prescribed, usually with some food. Antibiotic drugs help prevent your surgical site from possible infection that would impair your recovery. You will also be prescribed some pain medicine. If you choose not to take the pain medicine when you have pain, you may add to your recovery time. Your pain is usually strongest the first day after surgery and may then taper off. Likewise, you should find that you need the pain medicine less and less as time passes. It's best to take your pain medicine with food and only as long as you believe you need it. If you find that your pain is not decreasing after 1 week, please discuss this with your doctor at your first post-op visit. We're now going to present some information about your specific procedure. Open reduction and internal fixation, or ORIF distal radius fracture, commonly known as a fracture of the wrist's radius bone. The wrist is made up of 8 small carpal bones and the 2 bones of the forearm, the radius and ulna. The shape of the bones allows the wrist to bend and straighten, move side to side, and rotate, as in twisting the palm up or down. A fracture may occur in any of these bones. Common causes of fractures of these bones include falling down onto an outstretched hand, or from a more forceful injury, such as a car accident or a fall off a roof or ladder. Osteoporosis, a common condition in which the bone becomes more brittle, may make one more susceptible to a wrist fracture. The most commonly broken bone of the wrist is the radius. Many people think that a fracture is different from a broken bone, but it's not. They're the same. When the distal radius is broken, there's pain, swelling, and decreased movement of the hand and wrist. Often the wrist appears crooked and deformed. Fractures may be simple with the bone pieces aligned and stable. Other fractures are unstable, and the bone fragments tend to displace or shift, in which case the wrist is more likely to appear crooked. Some fractures break the normally smooth joint surface. Others will be near the joint but leave the joint surface intact. Sometimes the bone is shattered into many pieces. An open or compound fracture occurs when a bone fragment breaks through the skin. There is a significant risk of infection with compound fractures. Examination and x-rays are needed so that your doctor can tell if there is a fracture and to help determine the treatment. Sometimes a CT scan or MRI may be used to get better detail of the fracture fragments and associated injuries. In addition to the bone, ligaments, those structures that hold the bones together, tendons, muscles, and nerves may be injured as well when the wrist is broken. These injuries may need to be treated in addition to the fracture. The pattern of the fracture, whether it is displaced or non-displaced, and whether it's stable or unstable, are all factors in determining the treatment. Other important considerations include your age, overall health, hand dominance, work and leisure activities, the presence of any prior injury or arthritis, and any associated injuries. A splint or cast may be used to treat a fracture that is not displaced or to protect a fracture that has been set. Other fractures may need surgery to properly set and stabilize the bone. Fractures may be stabilized with pins, screws, plates, rods, or external fixation. External fixation is a method in which a frame outside the body is attached to pins which have been placed in the bone above and below the fracture site, in effect keeping it in traction until the bone heals. Your hand surgeon will determine as to which treatment is the most appropriate in your individual case. On occasion, bone may be missing, or may be so severely crushed that there is a gap in the bone once it has been realigned. In such cases, a bone graft may be necessary. In this procedure, bone is taken from another part of the body to help fill in the defect. Bone from a bone bank or synthetic bone graft substitutes may also be used. While the wrist fracture is healing, it's very important to keep the fingers flexible. Otherwise, the fingers will become stiff, hindering the recovery of hand function. Once the wrist has enough stability, motion exercises may be started for the wrist itself. Your hand surgeon will determine the appropriate timing for these exercises. Hand therapy is often used to help recover flexibility, strength, and function. Recovery time varies considerably, depending on the severity of the injury, associated injuries, and other factors as noted previously. Keep your hand elevated above the level of your heart or higher during the first 2 to 3 days after surgery, as this will reduce pain and swelling by keeping your blood flow to the surgical site at the best level. Proper blood flow advances healing to the site. It's not unusual for maximum recovery from a wrist fracture to take several months. Some patients may have residual stiffness or aching. If the surface of the joint was badly injured, arthritis may develop. On occasion, additional treatment or reconstructive surgery may be needed. Please keep your cast and dressing dry and clean from dirt, grease, oils, or any liquids until your next doctor's appointment or as directed by the medical team after your surgery. Keeping your dressing dry and clean further prevents possible infection, which may delay your full recovery. Please cover your dressing in a secure plastic bag if you desire to shower or bathe. It's important that no water reaches the dressing. Your cast has been split slightly to allow for expansion, as your hand will temporarily swell after the surgery. If your cast feels too tight, you may slightly further open the split in your cast to relieve pressure. As mentioned earlier, some who have had this procedure have had bone removed from their hip and used in the hand to improve hand bone growth and repair. For some, it's not unusual for the graft site at the hip to hurt more than the hand surgery. Remember to take your pain medicine as needed. Also remember to take your antibiotics medicine on time until you have used them all. Thanks, and we wish you a speedy recovery.